My name is Cliff Ropres, and I'm reading to you the MedSurs 1 exam. First part will be questions 1 to 30. Second part will be questions 31 to 49. If the patient is sleeping on a sunken cushion and is being transferred to the bed, what is the nursing action? The answer is replace or change the pillow. The answer is to replace or change the pillow. What is ABCDE? Allergy, bleeding, cortisol, diabetes, embolism. ABCDE stands for allergy, bleeding, cortisol, diabetes, embolism. After giving a shower, a skin lesion is seen. What warrants you to make you decide to see a dermatologist? The answer ABCDE. Again, that's ABCDE for allergy, bleeding, cortisol, diabetes, and embolism. Nurse is caring for a client with severe burn on both lower extremities. What is the percentage? One leg, posterior and anterior, is 18%. And that's two legs is equal to 36%. The client is scheduled for an sclerotomy and wants to know what the procedure involves. Which of the following statement is appropriate for the nurse to make? Large surgical incision will be made in burned tissue or a scar to improve circulation. Nurse is caring for a client who has partial thickness and a full thickness burn on his head, neck, and chest. Which should the nurse recognize as priority? The answer is airway. The answer is airway. A nurse is contributing to the plan of care for a school-aged child who has moderate partial thickness burns on both lower extremities. Which of the following interventions should the nurse include? Allow the child to set her own schedule of care. Allow the child to set her own schedule of care. When examining the client's skin who has psoriasis, what should be the description? Skinned patches, silvery scale. Skinned patches and silvery scale. The nurse provides instructions to the mother of a child with impetigo regarding the application of antibiotic ointment. The mother asks, when can she return to school? The answer is 48 hours after applying the ointment. 48 hours after applying the ointment. What is impetigo contagiosa? It's caused by Streptococci aureus that develop into postulant vesicles. It's called Streptococci aureus. A nurse is instructing a mother caring for a child who has impetigo contagiosa. Which of the following directions should the nurse plan to include? Wash the child's clothes in hot water. This is to kill bacteria. Wash the child's clothes in hot water. The nurse is making an initial assessment of a burn patient in the entire right arm, right anterior leg, and abdomen. What is the percentage of the burn? So you have arm 9%, abdomen is 18%, and the leg is 9%, total of 36%. A nurse's plan of care for a child's client with a burns on the upper torso, which nursing diagnosis should take the highest priority? Ineffective airway clearance related to edema of the respiratory passages. The answer is ineffective airway clearance related to edema of the respiratory passages. The nurse is caring for a patient with partial and full thickness burns on 65% of the body. When planning nutritional interventions for this patient, what dietary choices should the nurse implement? High calorie and high protein food for better and faster recovery. Use high calorie and high protein food. A client arrives for initial evaluation following diagnosis of SLE, which is systemic lupus erythematosus. The nurse understands that which of the following is the indicator of SLE? The answer is butterfly rash, the one on the face, butterfly rash. The nurse is caring for a 35-year-old male patient with eczema. Which nursing interventions are appropriate for a patient with eczema? The answer, because it's systemic, is to administer tepid bath and apply moisturizer. Administer tepid bath and apply moisturizer. A nurse is caring for a client who has burns to his face, ears, and eyelids. Which of the following is a priority finding to report to the provider? difficulty swallowing. Report difficulty swallowing. Nail disorder is paronychia. Which of the following signs and symptoms will the nurse document as data collection? This is SATA. Pain, infection of the nail separated from the tissue, nail is soft and brittle. All of the above except nail is clear. So that will be pain, infection of the nail separated from the tissue, nail is soft and brittle. The home health nurse assessing the skin lesions uses the PQRST. What does S stand for? The answer is severity. Severity. The home health nurse noticed a whitish growth in the foot of the patient who is suffering from diabetes. All of the following statements are true about tinea pedis, except it is treated by keeping the foot moist. It is treated by keeping the foot moist. So, except that. Your client treatment plan includes using the open method of burn wound management. It is most appropriate for the nurse to monitor a client being treated by the open method for which potential problem. The answer is infection. Infection could be the potential problem. A client complains for burning pain on his lower thoracic area. What skin disorder would this usually be? Herpes zoster. The answer is herpes zoster. A nurse is caring for a client who has herpes zoster. What treatment do you give your patient? Aciclovir for herpes zoster is aciclovir. A nurse is contributing to the plan of care for a patient who has herpes zoster. Which of the following actions should the nurse recommend to be included in the plan of care? Cover the infected area. Cover the infected area. Which of the following actions should the nurse include in the plan of care for the patient who has herpes zoster? Apply cold compresses to the affected area. Apply cold compresses to the affected area. So cover the affected area and apply cold compresses to the affected area. What is atopic dermatitis? Which of the following findings should the nurse expect to see? We have eczema, rash and thick skin. Eczema, rash and thick skin. A nurse is reinforcing teaching with a 20-year-old patient who has atopic dermatitis. Which of the following information should the nurse include? The doctor might recommend an antihistamine to help control your symptoms. The doctor might recommend an antihistamine to help control your symptoms. The burn wound is periodically debrided using hydrotherapy. Which nursing intervention is essential either before or after the therapeutic? Pain medication. The answer is pain medication. An assessment, a linear crack from the epidermis to the dermis is noted at the corner of the patient's foot. What do you call that? It's called fissure. 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 The nurse is caring for a client who has recurring herpes simplex, so type 1. The nurse should perform a focus assessment on which of the following areas of the client's body. The answer is mouth, bibig. The answer is mouth. End of part 1. Please wait for part 2 from 31 and onwards.